Now what we're dealing with here is a little bit of tightness in your shoulders rolling forward in this pec muscle, this pectoralis muscle. So your muscle in your chest, which is responsible for crossing your arm and raising your arm up high. Okay, that's that muscle that we feel in your nugget right there. All right, so now you've been having some pain with that motion of getting back and reaching back and hitting that ball. So we're going to try to loosen up and make some of these muscles relax a little bit for you so that they're not so angry when you rotate around. All right. So whenever I say go, you're going to raise your palm back that way. So you're going to do that motion right there. But what's going to happen is I'm going to resist you. So I'm going to push a little bit of pressure right here. Feel that? Not a lot. You're only going to push about a 2 out of a 10. So if this was a 10, you're going to push 2 out of that. Got me? I'll do this. I'm going to hold you for 6 seconds, and then you're going to completely relax. And then after that 6 seconds, I'm going to push a little bit further into the stretch. We're going to do 3 rounds of that. At the very end, I'm going to hold it for a little bit longer, like a stretch. Any questions? Should be no pain. So if you feel pain, stop me and let me know. Okay, so let's get the shoulders down and back. There we go. Got that internal rotation there. All right. Push against my fingers there. Push, push, push. 1, 2, 3, 4, 5, 6. And relax. Big deep breath. And exhale. Good stuff. As we relax, I will push a little bit further there. Okay. And again, push. 1, 2, 3, 4, 5, 6. And deep breath. And exhale. Good stuff. I'm not pushing a little bit further. And push again. 1, 2, 3, 4, 6. Last one, big deep breath. And as we exhale, I'm going to push it a little bit further into that stretch. You notice the change there, how far you've come down? When's your next volleyball game?
Next year.
Next year? I got you. Or we're getting ready. All right. All right, so you're having a little bit of tightness back here in your lat, and maybe a little bit of pain there from that tightness. Kind of feeling a little bit of knots and tension there. Your lat is that latissimus, that area right there where I like to tickle you at, right? So what you're going to do is I'm going to hold your arm, and when I say go, you're going to pull your elbow to your low back. So you're going to do that motion right there. Got me? And I'm going to pull against you for about 6 seconds. But I need you to not pull hard. I just need you to pretend that like you start that motion. You got me? You're going to feel a little bit of resistance, but we shouldn't be pulling hard against each other. Okay? I'm going to do that for 6 times, and then we're going to rest. You got me? As I move through each time, sorry, I'm going to do that 3 times, not 6. 3 times, 6 seconds. As we move through, I'm going to pull you a little bit further and a little bit further. You might feel a little bit of stretch through your armpit and then your back here. Okay? Questions? Should not hurt. You let me know. Okay? Sit on your side there, right there. Good. So here we go. Okay? Getting you in that part right there. Good stuff. Okay, now start pulling your elbow to your, there you go. A little bit less. Right there. 3, 4, 5, 6. All right, now relax completely. Deep breath. And exhale. I'm going to pull you a little bit further. Okay. Now go again. Good stuff. 1, 2, 3, 4, 5, 6. Deep breath. And exhale. Stuff. Pull you a little bit further here. And again. 1, 2, 3, 4, 5, 6. Good stuff. Now last big deep breath. And exhale. And I'm going to pull just a little bit, and I'm going to hold this position for about 20 seconds. All right, here. I know we have had some scapular rhythm issues. You got rhythm? Yeah, you can dance. But the scapular rhythm means as you're raising your arm up to the side, abducting, that your scapula of your shoulder blade is also moving with that. Okay? So what we're going to do this time is I'm just going to help try to move your scapula or your shoulder blade, and you're just going to kind of relax your arm to the side. You can even just rest it right there. All right? So I'm going to find your shoulder blade here, and I'm going to try to help rotate it just a little bit. If you feel uncomfortable or painful, just let me know. It might feel a little tickle, but just try to focus on your breathing, okay? All right, so I'm going to roll into your scapula here. Yep. Good motion. Okay, so I'm just going to rotate it a little bit. There. There. We can get into a little bit of that. This. Good there. So with that pain that you're having right here, you're also having a little bit of limited motion. I understand when you go into shoulder flexion, which is this motion right here. Okay. So what we're going to do is we're going to move through that motion, try to get to the point as far as you can move. But what I'm going to do is I'm going to use this part of my hand and I'm going to press down right inside this area right here. What I need you to do is sit up nice and tall, pull those shoulder blades back and down while you move through this range of motion, okay? We're going to do 6 of these, and we're going to rest and do another 1 to 2 sets, okay? So here we go. Here's your pain right there. Sit up nice and tall. As you move through that range of motion, I want you to go straight in front, far as you can, far up as you can. Good stuff. Sit up nice and tall. Good. Now we're going to work on your internal rotation. So you are a volleyball player, right? And you are. So when you go to hit a ball overhead, that's a lot of this motion right here, internal rotation. Okay, so that's the motion that we're going to do. So I'm going to let your elbow rest on my shoulder, and then you're going to rotate your hand to the floor as far as you can without pain. All right? And at the same time, I'm going to push down on your shoulder and kind of back on your arm bone there. So what I need you to do is sit up nice and tall, really hold that posture up good, good, strong, proud posture. And then when we do this, we're going to do 6 of these. Okay, and this is going to try to help you get more of this motion right here when you go to hit that volleyball. Okay, so let that arm rest right there. I'm going to press down and this way. When you rotate your palm to the floor, sit up nice. It's all good. 1, 2, 3, 4. Are you feeling the pain there?
Not
Good.
really.
Good. Okay. You feel that in that joint right there? Okay. Since you've been having trouble with raising your arm out to your side, that's called abduction. We're going to do a movement with me pushing pressure on your joint. A lot like some of the earlier movements that we did. I'm going to push on the front side of your shoulder right here, and I'm going to push on the back of your shoulder blade. And all I want you to do when I say go is you're going to raise your arm out to your side as far as you can. If you have any pain, you're going to stop me and let me know. But we shouldn't have any kind of pain, all right? Also, we're going to do 6 of these, and you can count to 6, right? Yes, all right. And then we're going to rest, and we're going to do another 2 to 3 sets. 2 sets, 1 or 2 sets. All right, got it? Here we go. Slide close to me, right there. Good. Sit up nice and tall. Pull those shoulder blades down and back. Good stuff. Okay. Hold this arm out to your side, and I'm going to push right there. There. Now ready? Go. Raise your arm out. Good stuff. Feel that clicking in there? Good stuff. Nice. All right. What we're going to do now is what we call mobilization with movement. So when I ask you to, you're going to move your arm out just like this, up as high as you can, okay? What I'm going to do is I'm going to push into your joint with your arm bone, and I'm going to put a load on that bone. It may feel like it's more difficult to move, but you should not have any pain, all right? We're going to do 6 of these, then we're going to rest. We're going to do 2 more sets of those 6, all right? You have any questions for me? All right, slide closer to this side of the table here. Very good. All right. So again, we want to try to keep that shoulder down and back. Pinch those shoulder blades together. Good stuff. And then when I say go, you're going to move your arm up just like this. Okay? Ready? Go. High as you can go. Good job. 3, 4, 5, 6. Relax and rest. I understand you've been having some pain in your AC joint right here on the end of your collarbone. So we're going to do a little bit of mobilization to help with that pain, right? I'm going to put your arm in a rotation state right here where I can kind of rotate and control the rotation. But I'm also going to put some pressure just on the inside, not right on that joint, but just on the inside. And I'm going to push pressure kind of at this angle here. I'm going to do pulses with you so that it can relieve some of that pain, but I need you to let me know if it's painful, right? There should be no pain with what we're doing. And if there is, you just let me know. So I'm going to do about 30 pulses here, all right? And it's just going to feel like I'm just sitting there doing like that, okay? You got any questions for me? Okay, here we go. Again, if you feel pain, just let me know. Right there is where you've been hurting. Good. On the inside of that. Okay.
Probably for me, the techniques that I struggle with the most are related to the AC joint. Not necessarily because the delivery of the technique, but the technical part of actually applying pressure to an AC joint. From my experience in clinical practice, the AC joint is very sensitive, especially when we have some sort of separation there or a sprain there. So what I struggle with is the placement of hands in on the AC joint or near the AC joint, even when we have those acute injuries, and then also the force applied. My patient that I used in the videos didn't have a trap, but if the patient actually had a trapezius, then that may be a difficult thing to be able to push through that actual, level of that trap muscle. So I guess my strategy would be to just practice on more bodies and body types and see what is tolerated, and also different locations in that hand placement as far as where they're sensitive at, and not be so closed off necessarily to the idea that everything you do with the AC joint hurts. So, but any feedback on that